Hi, hello, namaste, namaskara, namaskaram, vanakkam. I am Nima Narayanan Nair, your host for today. And yes, I am the one who gets to ask the questions you have been too shy to ask your doctor. Today, I am joined by two of the sharpest mind in the field, Dr. Karthik Vishwanath and Dr. Roshan Shetty. Together, we are unpacking everything you thought you knew and everything you never even knew you needed to know about Botox, fillers, hair GFC, drip therapy, hair transplant, liposuction, and even surgical and non surgical nose corrections. This episode is designed to cut through the noise. By end of this conversation, you will know exactly what's fact and what's fiction. So let's start with the hottest buzzword in aesthetics, Botox and fillers. Two different molecules, two different results. So Dr. Karthik, what are the things people normally get wrong about Botox?
The biggest myth that Botox freezes your face, well, it doesn't. So, Botox will freeze one's face if it's when there's a wrong dose on a wrong muscle by a wrong person. So, let me tell you one thing, Botox is like seasoning. So, a pinch can change a lot, but a handful can ruin the entire dish. And people think Botox fills wrinkle, but it's wrong. It's a filler's job actually. What Botox does is relaxes the muscle and fillers restores the volume. If someone thinks Botox and fillers are like twins, then they'll be disappointed. Botox and fillers should be treated like a distant cousin who work well together in combination. Only then you get good results.
So you're saying Botox is not the villain. Instagram makes it one.
Definitely not. Like Botox can be used for other purpose like migraines, excessive sweating in the palms, or jaw clenching, and so many other things. Stress or strain in the trapezius muscle, the neck pain, and all that. So Botox is just a small chapter.
So here's something people rarely talk about. How early is too early?
Well, we don't go by age, we go by skin behavior. There are some people who get dynamic lines at the age of 24 itself, and some people nothing at all, even at 34 or 40. Preventive Botox isn't about looking younger, it's about aging better.
Now coming to fillers. This is the most misunderstood part of aesthetic. Why do they get such a bad reputation?
Something that is overdone. Fillers are actually supposed to be invisible.
Okay.
If someone says, "Oh, you look nice today," that means you have done a good job with the filler. But if someone says, "Did you get something done?" that means it's not a good thing. So something has gone wrong.
So now let's do some myth busting moments. Myth. Fillers stretch the skin permanently?
A good quality filler generally integrates very well with the tissue and breaks down very slowly. And skin does not sag more because of fillers.
Okay. Myth. Botox and fillers are addictive?
The results are addictive. Maybe the product is not.
Now let's get into the topic that's gone viral, GFC. But recently, many people have also been asking about QR and whether it is the same thing. So let's clear the fog. What's the real difference between GFC and QR?
Great place to start. GFC, as we all know, is growth factor concentrate, where we extract the purest form of growth factor from patient's own blood, and then we use it as a signaling molecule to wake up the hair follicle that are dormant. Whereas QR is a broader term used for any platelet-rich treatment.
So QR678 is more like an umbrella term, whereas GFC is a refined technique.
Yes, GFC is like a upgraded cousin of QR or a plain platelet-rich treatment. And QR or regular PRP depends heavily on equipment and technique, so results vary more. Whereas in GFC, the concentrate is 4 to 5 times higher and the platelets are undamaged.
So how bad is the pain?
So if you have survived threading or waxing, I think you can survive GFC. It's 20 to 30 minutes of procedure of mild discomfort for a long time follicle support.
So that was a fantastic answer. I think they would have got a better answer to know how bad is the pain. So coming to what kind of hair concerns respond best?
Probably postpartum shedding,
Okay.
early androgenetic hair loss, stress-induced thinning, and it's brilliant as maintenance after a hair transplantation.
Coming to the next topic. This one always sparks curiosity. drip therapy? Is it wellness? Is it medical? Or is it Instagram?
It's a blend of all three, actually. Drip therapy is a curated vitamin and antioxidant infusions meant to support recovery, hydration, skin glow, immunity, depending on the formulation.
So, what's the biggest misconception?
That drips can replace a healthy lifestyle. They cannot outsmart poor sleep or stress. They complement wellness, they don't create it.
So, actually, many aesthetic surgeons now use drips pre surgery to optimize patient recovery, improve tissue healing, and reduce downtime. So, let's talk about hair transplant, an area where fear and information are practically siblings. What is the one truth people absolutely need to hear? Dr. Roshan.
So hair transplant doesn't give you new hair. It's redistribution of your existing permanent hair. Think of it as a real estate planning on your scalp.
That was a fantastic answer. Is it true that hair transplanted hair falls out?
Yeah, that's normal because once you transplant, probably at the end of third month, it starts shedding, and 6 months onwards, it grows, and 6 to 12 months, it takes a natural look and blends seamlessly with the native hair.
So now let's get into some myths and facts. Myth: one session and I'm done for life.
So generally, one session of hair transplant is enough, but you need maintenance of your hair, that is your non-transplanted hair, maintenance will be required.
It looks artificial.
With recent trends like micrografting and proper angulation, usually you can't distinguish from the natural hair.
Only men get hair transplant done.
Absolutely not. Even women get hair transplant commonly, especially for thinning hair, thinning partition line, traction alopecia, postpartum hair loss, and all.
So now coming to liposuction. Liposuction is probably the most whispered about procedure and also the most misunderstood. Let's clear the air.
So liposuction is not a weight reduction procedure. It's a body contouring procedure. So basically we sculpt the body and we don't shrink the body.
So what about repeating lipo? People think it's one time only permit?
Definitely not. You can repeat the liposuction again, probably for fine tuning or touch up. And the key is patient selection. If the weight is fluctuating drastically, no lipo will hold shape.
So I want to touch on something many women think about but rarely talk about openly. Mommy makeovers, a term that's trending everywhere but often misunderstood. Doctors, what exactly is a mommy makeover?
A mommy makeover is not one fixed surgery. It's a custom combination of procedures designed to restore the areas most affected by pregnancy, usually the breasts, abdomen, waistline, and sometimes even the face. Think of it as restoring harmony, not creating an entirely new person.
And doctor, what are the most common procedure women choose?
Yes, so typically it's the breast lift or the breast augmentation, tummy tuck to repair the abdominal separation, liposuction to contour, and sometimes fat grafting and postpartum scar corrections.
So it seems to be a lot of emotional weight attached to this decision too.
Absolutely. Many women feel guilty for wanting this procedure, but it's really about confidence restoration, not vanity. Pregnancy changes the body structurally. No amount of gym or diet can repair muscles that have been separated or breasts that have lost the elasticity.
So now let's clear some myths because this topic is full of them. Is it too risky to do multiple procedures together?
When planned correctly and performed by trained surgeons, combination surgeries are safe and actually reduce total recovery time.
So is it that you should do it only after you're done with having kids?
True, for longevity of results, but not an absolute rule. Depends on the woman's goal and life plans.
So what does recovery realistically look like?
Most women resume their basic activities in 7 to 10 days, and a full recovery usually takes 4 to 6 weeks. The key is planning, especially because many moms are managing kids, households, and other work.
Okay, coming to the big question, who is the ideal candidate?
A woman who has completed breastfeeding, is close to her ideal weight, has abdominal muscle separation, struggles with loose skin, unresponsive to diet or exercise. Most importantly, someone doing this for herself.
Okay, I love that because so many women put themselves last. This conversation isn't about changing who you are, it's about helping you feel like yourself again after motherhood.
Exactly. We are restoring confidence and not transforming identity.
So, doctors, let's start with the basics. What does a modern hair transplant actually involve in today's day?
So, modern hair transplant involves redistribution of the hair, usually from the back of the head, to areas which are usually thinning or balding.
These donor hairs are genetically resistant to fall, so once transplanted, they behave just like they would have in their original home.
There are so many terms floating around: FUE, FUT, DHI.
Of course, FUE is follicular unit extraction, where we extract individual grafts one by one with minimal scarring, with natural results and faster recovery.
FUT, also called as the strip technique, a small strip of skin is removed from the back of the head and dissected into grafts. Still useful for specific cases, but FUE is the gold standard today. There's one more thing called the DHI, that is the direct hair implantation, a variation of FUE where grafts are implanted directly with special pens. Great for precision, but not always necessary. The technique matters, but the real magic is in planning the density, the angle, the direction, and the hair design.
What about shedding? Everyone panics when the transplant hair falls out.
Shredding is completely normal. The transplanted hair falls within 2 to 6 weeks, then enters a resting phase before regrowing around third or fourth month. Full results takes around 9 to 12 months. So patience is a very crucial part of this process.
What about candidate selection? Not everyone are suitable for hair transplant, right?
Exactly. The ideal candidate is someone who has a stable pattern of hair loss, has a healthy donor area, understands that the results take months, and is medically fit, has realistic expectations. We sometimes turn people away because transplant isn't the answer for every type of hair loss.
So, coming to post op care, how does it look like? Because people imagine huge bandages and dramatic downtime.
Not anymore. Today's FUE transplants are minimally invasive. Generally, the post op involves a gentle wash protocol, avoiding direct sunlight, sleeping elevated for a few days. You can expect some mild swelling. Following a recovery plan, most people return to work in 3 to 5 days.
Wow, I just loved that. So, it's not just cosmetic, it's personal. So, now let's talk about one of the most intriguing procedure in aesthetics: nose corrections. Rhinoplasty has this reputation of being dramatic, while non surgical nose shaping looks almost too easy to be true. Doctors, let's decode all of it.
Rhinoplasty, in its simplest definition, is architecture. We reshape bone and cartilage to improve the form and sometimes even the function of the nose. Whereas non-surgical rhinoplasty, on the other hand, is a camouflage procedure where we use dermal fillers to reshape without altering the underlying structure.
So, that's a great starting point: remodeling versus retouching. But what issues can be corrected non surgically and what absolutely requires surgery?
Non-surgical works beautifully when someone wants, like you say, a higher or a smoother bridge, a straighter profile, minor tip lifts, small symmetry adjustments. But for anything involving a wide nose or a large hump, significant crooked nose, breathing issues, or a droopy or a heavy tip, we need surgical rhinoplasty. Fillers cannot fix structural problems.
So I think people underestimate the stakes with non-surgical nose work. It seems quick and easy because it's a filler.
That's the misconception. Nose is a high risk vascular zone. One wrong injection can compromise the blood supply, lead to blindness. So, non surgical rhinoplasty needs absolute anatomical precision. In the right hands, it's safe and incredibly effective. In the wrong, it can be very dangerous.
Okay, so now let's talk about surgical rhinoplasty. There's this fear that it always looks done or too perfect, almost like movie filter in real life.
A well done rhinoplasty should look like you, just more balanced. The goal isn't to give every person the same social media nose. In fact, a big part of the modern rhinoplasty is preservation, maintaining your natural anatomical identity while enhancing proportions.
So, can you actually walk us through what happens during surgical rhinoplasty?
Sure, depending on the concern, we may remove a hump, refine or support the tip, straighten the septum, narrow the width, or use a cartilage graft for support.
It's like sculpting with millimeter level precision. We are working with bone, cartilage, and soft tissue, all of which behave differently.
So, there are also cultural and ethnic considerations, right? Because not every nose needs to look westernized.
Exactly. Indian noses and South Asian noses generally vary widely in skin thickness and tip support and bridge projection. We design based on ethnic harmony, not imported beauty standards. The goal is a nose that matches your face, your heritage, and personal aesthetic appearance.
So, what are the myths you would like to clear today?
One of the most common myths is non-surgical rhinoplasty is risk-free, whereas in fact it requires the highest anatomical skill as compared to any other filler procedures.
So, another myth is surgical rhinoplasty will make me look like someone else. But the fact is that with modern techniques, which prioritize natural and personalized results, you get a very appealing and fantastic results.
Fillers can fix any nose issue. In fact, fillers cannot correct structural, size or breathing problems. They are only used for camouflage.
Results of surgery are visible immediately, but the fact is you see an early result quickly, but refinement takes time, especially at the tick, maybe 3 to 6 months.
And for someone trying to decide between surgical and non surgical, what's your advice, Dr. Karthik?
Ask yourself two questions. Do I want a temporary enhancement or a permanent structural change? Second, is my concern cosmetic or functional? If it's minor contouring, fillers. If it's structural or functional surgery, definitely rhinoplasty.
And now, the emotional side, because a nose change affect how people see themselves, Dr. Roshan.
Absolutely. The nose is central to facial identity. A good correction will boost confidence, posture, and even expression. We always make sure the patient is mentally ready and not doing it just because of external pressure.
This has been such an insightful conversation, and honestly, the kind we wish more people had access to. Thank you, Dr. Karthik, Dr. Roshan, for breaking down myths, simplifying science, and giving our listeners clarity in a space that's often crowded with confusion.
Thank you, Nima, for having us.
Thank you as well, and it's a great initiative that you have taken today to spread awareness among the people, especially the myths that people have regarding the cosmetic surgery. So, well done.
Thank you. Thank you so much. If you find today's episode valuable, stay tuned. This is just the beginning. In coming episodes, we will deep dive into fat grafting, acne scars, and anti aging strategies, and more. This is the Consultation Room. I am Nima signing off. Stay informed, stay curious. Remember, good decision begin with good conversations.